Welcome to our website. I'm Dr. Meera Ragavan, consultant obstetrician and gynecologist with special interest in urogynecology and minimal access surgery. We offer the entire spectrum of services for women, ensuring well-being of women right from the teenage until menopause. We offer the whole range of maternity services, especially catering to care of high-risk pregnancy, diabetes and pregnancy, as well as contraceptive services. The clinic offers entire well women check, advice, and preconceptional counseling, especially for ones with diabetes or pre-existing diabetes and diabetes and pregnancy in the previous pregnancies and medical disorders complicating pregnancy. We offer contraceptive counseling for women who have delivered and postnatal physiotherapy as well. We cater for the antenatal care of these women and ensure painless labor or minimal pain during labor by specific techniques. Entire care of gynecological services is also provided in the clinic, right from well women check, specified to particular age group, looking at specific disorders which can arise during the certain age group. I can offer good multidisciplinary advice regarding management of polycystic ovaries, which is a common disorder both in the adolescent age group as well as young women of reproductive age group. As menopause catches on, specific problems arise to women, especially in the form of pelvic organ prolapse and incontinence. My special interest is in the treatment of urinary incontinence. Urinary incontinence means involuntary leakage of urine, either due to the urgency, which is because of an overactive bladder, or due to stress incontinence, which is due to the laxness of the pelvic floor, and whenever the woman coughs or sneezes, there's involuntary escape of urine. This is quite common. However, our women are quite embarrassed to talk about it and not come forward with these complaints. Let me assure you, this is quite treatable, and we offer the whole range of treatment services for any woman who suffers from incontinence. This can range from simple lifestyle advice, medications for a certain period of time. For some of the elderly women, they might need to continue for lifelong. You probably would be advised to use hormone cream as a major step to improve the strength of the pelvic floor, some amount of bladder exercises, and restricted caffeine and tea intake. In women who do not respond to these measures, we can offer outpatient or day case procedures for treatment of both their overactive bladder and stress incontinence. My special interest is in doing day case procedures, namely the vaginal tapes which cure the stress incontinence as under a pudendal block, which does not require a general anesthetic or a spinal anesthetic. You can go home the same day without the use of a catheter and should not have any problems with pain or emptying your bladder. Extending the service of urogynecology, I also specialize in laparoscopic surgery as well as robotic surgery. I believe in preserving or conserving the uterus during the management of prolapse. Vaginal hysterectomy is not the answer to any of these problems. Many of the women would do better if we can conserve the uterus. So I tend to do either laparoscopic or robotic sacrocolpopexy or laparoscopic or robotic hysterosacropexy in these women. Just to go through what robotic surgery involves, I would like to demonstrate to you the various components of the surgical robot. On the right, you can see the Da Vinci robot, which is the surgical robot, which is mainly operated by the surgeon. This is known as the patient cart and has the camera, which is in the middle arm, and 3 other arms holding on to the different robotic instruments. The second component of the robotic surgery will be the console, where the surgeon who's operating the robot sits and has the masters for controlling the movement of the robotic arms. The third component is the vision cart, which is basically like a stacker at the laparoscopic surgery, And it has a monitor which is useful for visualization of the entire operation by the assistant who assists during the operation, standing beside the patient. So looking at these major components, it's very understandable that the main person who controls the robot is the console surgeon, and the laparoscopic instruments are introduced by the assistant to assist during the procedure. The advantages of the robotic surgery, especially with reference to urogynecology, is beautiful access to the deep pelvis in these women, as well as very good results of both sacrocolpopexy and hystropexy. The recovery rate of these women following this procedure is excellent because of lesser pain and good ambulation. There is lesser urinary retention. Better ambulation prevents further complications like deep vein thrombosis and wound infection, and patients are able to go home on the second day, if not the first day. This is pretty much the overview of the services we offer within the clinic across the spectrum of both maternity, gynecology, with special preference to urogynecology services. Thank you.